Hi everybody, this is Dr. Ty Vincent. One more, this is the last one I'm recording, I don't know what order you watched them in, but another video about a natural substance to consider to help prevent severe infectious illness with the coronavirus, or other respiratory illnesses for that matter. These things are not specific to coronavirus, these are things that help your body fight off respiratory infections and other types of infections in general, and help you recover better, help you not get so sick if you do get the virus. So all good things, right? They're natural things that your body knows how to use, that have very low toxicity, that are very inexpensive, and that are widely available. With the exception of the intravenous vitamin C I discussed in the other video. You can't just get that at home. So this one's about vitamin A. Everyone's heard of vitamin A. It's involved with, night blindness, vision, and different things. Vitamin A is also critical for what's called mucosal immunity. That means immune function at a mucous membrane barrier. Part of it is that it helps fortify the barrier itself. So the actual physical structure of the mucous membrane itself is partly dependent upon vitamin A. So it's like build a wall, right? There's a catchphrase for you. Vitamin A helps you build the wall between your bloodstream, your tissues, and the outside world, whether it's in the nose, the mouth, the eyes, or the entire airway and gastrointestinal tract. All of those are mucous membranes. Vitamin A is critical to the maintenance of that barrier function. Vitamin A also has some antioxidant potential and some immunological function beyond just the mucosal barrier function. It helps promote the production of antibodies that are secreted onto mucosal barriers. That's another specific defense mechanism against different viruses and things that you have developed immunity to in a general way. So if you have good immune antibody production against all the other coronaviruses you've encountered in your life, which if you're an adult, you've probably already been infected with 50 or more coronavirus strains in your life, odds are, because there are hundreds of them. And they have animal reservoirs in the world, and they're always coming around and circulating, and they're always going to be here too. So having good immunity is key. I tried to do some research and look at specific studies that have shown the use of vitamin A as a therapeutic intervention in respiratory infections, and I couldn't find any, which is no surprise. As I mentioned in another video, there's really not a lot of financial support or publication support in favor of natural substances for things when you can fund drug studies instead. So you don't see that. But what you can find in nutrition journals and pediatric journals and other things where epidemiological research is presented is that vitamin A deficiency lends itself to severe and more often fatal respiratory infection problems with bacteria and viruses and what have you. So we know that having too little vitamin A, bad, okay, very bad in terms of respiratory infections. And so therefore having some vitamin A is good, having more vitamin A is probably better, but we don't know where more and too much starts to merge, right? We don't know that progression because nobody will do therapeutic intervention studies with this stuff. So I guess if you have a child, I would say at least 5,000 international units a day. Vitamin A has very low toxicity. And I have given vitamin A to adults for short stretches of time to treat acne, because it turns out it helps with clearance of skin when you have severe acne, in doses as high as 400,000 units a day, which you don't need in this context. Accutane, the drug for acne, is a mutated Frankenstein version of vitamin A, for those of you who didn't know. It's actually a drug created to be vitamin A, but it has loads of wacky toxicity, right? And as a result, people start to wonder, oh, maybe vitamin A has toxicity too. But it's very, very hard to find any research suggesting that vitamin A has any toxicity, actually. In fact, I looked in the past and I couldn't find any. It's thrown around out there in the world of medicine that vitamin A has the potential for toxicity, specifically in pregnant women, but I still couldn't find a single bit of published evidence to say what that toxicity is or how that works. So I don't know for a fact that it has any toxicity, but the caution is specifically in pregnant women. It's sort of just the general belief in the medical field, which is so frequently wrong, but in this case I can't disprove it with any published research. So pregnant women probably shouldn't take more than maybe 10,000 units a day if you just want to play it safe. That being said, I gave my wife 25,000 units a day during her pregnancy, but you don't have to do what I do. So as an adult, if you want to take just a daily amount of vitamin A to have good, effective mucosal immunity, 25,000 units a day is I think, fine maintenance. If you start to get sick, start to get respiratory symptoms, you can up it. You can go to 50 or 100,000 units a day and take that for weeks through the course of your illness, and that should be fine as well. There's really no evidence that that's going to harm you. There's also, unfortunately, no evidence that it's going to fix the infection for you. Not direct therapeutic evidence like a placebo-controlled randomized trial, which we do have, for some of these other things I've discussed. So vitamin A is the last thing. That's it. I talked about vitamin A, N-acetylcysteine, vitamin D, and vitamin C for the treatment of these respiratory illnesses, coronavirus et al. So maybe you can arm yourself a little bit better against the pandemic we have going on right now in a natural, safe, and cost-effective way if you look into some of these things. Good luck. Thanks.